welcome to our webinar today on the interdisciplinary approach to postural care. What we'll do first of all is cover, really review the importance of postural care. It's always a good place to start, just to raise awareness really and make sure that we're all understanding the role of postural care and why it might be important. And then we'll have a look how a team of professionals working together can make a significant difference in the management of postural care. Hopefully understand really about the different professionals who might be involved, those that contribute to creating effective care plans for individuals. And by the end of the session, hopefully you'll have an understanding of the benefits of this collaborative approach and hopefully some practical takeaways too. Now, before we start, just to quickly recap postural development and postural care. Those of you who are new to our webinars or maybe new to postural care, obviously we haven't got much time together for these webinars. So if this is something that you wanted to have a look at in a bit more depth, then please do contact us. We can share our past webinars with you and all the resources we have on 24-hour postural care and specialist seating specifically, if that's something you wanted to do in terms of increasing your knowledge around that. But essentially, as we grow, we learn from and respond to information that is sent from various sources, such as our visual, our vestibular and proprioceptive feedback. Now, when we think about the individuals that we work with, damage to any of the body systems can affect the ability to interact with that information. So what will happen is that individuals will find it increasingly difficult to achieve those protective postures that we are striving for. Now, posture is directly related to a person's health, well-being and quality of life. So this is about the human cost. There are going to be physical, psychological, emotional effects of body shape distortion, and sadly some of these are going to be severe and life-threatening as well. So this is why it's really important that we are proactive, we identify risk, and we reduce these severe and life-threatening consequences. Now, if we don't protect the body structure, this lack of postural care, specifically in sitting as well, can cause tension on the body, and what we can see is an increase in things such as pain, especially for those who maybe have tonal problems. They already have that spasticity related pain. Unsupported postures can also cause fatigue because we're inefficiently using the body structure. So all those body segments are not working together efficiently, we're fatiguing quickly. And as we know, fatigue can significantly restrict our ability to engage in daily life, to interact with our environment. So having that impact, that poor impact on psychological and social functioning too. Another thing to be mindful of when it comes to improper postural care is the impact it can have on physiology. So thinking about being able to open up the shoulder girdle and take a good deep breath to get oxygen around the body. Digestive issues because of the compression that might be happening on the internal organs. Not being able to get good head control to be able to have safe eating and drinking. So research shows that this inability to maintain this upright midline trunk position can result in a decline in health, and we primarily see this in that physiological dysfunction. There are also going to be, so those are the physical components, but there are also going to be psychosocial impacts as well. So somebody maybe is unable to sit out comfortably, they don't have the adequate positioning aid to enable them to sit out safely, or they're requesting to go back to their bed because they're uncomfortable. And that isolation, being confined to the four walls of their bedroom, that can come from that. The dependency element as well, and not being able to transfer safely, not encouraging that independence and safety and mobility within the chair. Not being able to access their environment, so especially in multi-user environments, maybe in care home environments where activities and participation is a big part of daily life, and not having the equipment to enable that safely. And in turn, all of this leading to low mood and low confidence. And then we get that vicious cycle then of losing motivation to want to engage and participate. Research has shown that isolation is twice as harmful as obesity, which is staggering when we think about maybe the resources and the funding that goes into obesity management, but actually what about those individuals who are heavily isolated, and how we can play our role in enabling them to interact with the outside world. Now, believe it or not, body distortion is not inevitable. And this is a myth we're trying to get away from. No matter how complex an individual it is, if we are proactive and identify risk and get the right equipment in with the correct positioning techniques at the right time, we can help to protect body shape. We should never be using the term unseatable. We should be identifying risk and working proactively to reduce those significant life-threatening consequences from happening. And it's never too late. The success might be limited, depending on the stage that we get involved, but it's never too late to try and make a difference to their quality of life. Now, in the simplest of terms, when we talk about the importance of posture, postural care is essentially the holistic use of any technique, any intervention that we put in place that helps to minimise postural abnormality whilst enhancing functional movement. And this approach where we aim to preserve, but actually in some cases even restore body shape for the individuals that we work with. And when we talk about the role of seating within this 24-hour postural care approach, these are really the key principles that we strive towards within CareFlex. Comfort is our top priority. We've had some independent testing done on the chairs. So University of Salford came in, and it's actually been published now in the Journal of Rehabilitation. But they took the chairs, and we're hoping to see maybe the impact of sitting posture on things like physiology and really the biomechanics around that. But actually what they found, and what was a key take-home message from that research, was regardless of the clinical benefits, if the user wasn't comfortable, then they simply wouldn't use the chair. So if we don't have that compliance with our interventions, we aren't going to meet our clinical objectives anyway. So the users has to be comfortable, they have to feel secure and safe within that piece of equipment so that we can see that consistent use to be able to meet our clinical objectives. We've of course got posture that we've mentioned, but how this then links into function is really key. To be able to have this functional movement of the upper limbs, to have this distal control, we have to have proximal stability. So that pelvic stability enables the upper limbs to be free from that low bearing role and to allow individuals to participate in activities and things that are important to them. So posture is really key for function, and that's why it's an important part of postural care. The same with pressure, it's inextricably linked. So, I mean, it's pretty self-explanatory. The way we hold ourselves or the way we position our body segments is going to have a direct impact on the pressure going through that specific body site. And I think there's definitely a shift in the awareness and people are understanding the role that posture plays in pressure management. We also have the safety element. So this goes back to the health when I said about physiological function and making sure that we are promoting optimum health for individuals, but even just safety within the chair itself. So being secure, being safe within the chair, and being able to adapt to different situations, being able to think about safe transfers and positioning within the chair. So, for example, those individuals who will have a history of sliding down the chair or falling from the chair, we need to think about those incidences and import that into the postural management plan. And then lastly, we have well-being when we think about those psychosocial factors and actually the improvement that we can see in individuals' quality of life alongside our clinical objectives. Now, those of you who are interested in posture may have heard of the Posture and Mobility Group, and in the UK they are promoting this collaborative approach towards postural care. This can help to reduce the risk of those postural deformities and all those significant severe secondary complications that we mentioned, and ultimately improve quality of life for individuals with physical difficulties and movement difficulties. But I think we have to remember here that postural care is not managed by one person alone, and it's going to be the product of this team effort. Each team member will bring a different skill set to the table. And then by working together, we can ensure that the postural care intervention not only addresses things like postural alignment, but also all those key principles that we've mentioned, like their functional needs, their health outcomes, their quality of life and their well-being, to really get that ultimate goal of compliance with that postural care intervention. Now, multidisciplinary teams, MDTs, I'm sure most of you in the audience will have heard of this term, which is essentially a group of health and social care professionals from different specialisations, depending, of course, on the individual needs and the client group within that area. Now, what I wanted to do is really highlight the difference between multidisciplinary, this term that we're all familiar with, and interdisciplinary. So multidisciplinary, MDT, that refers to, I guess, the amalgamation of competencies and the experience of all those multiple professionals within the team who generally stay within the boundaries of their specialties. So we'll see several disciplines working in parallel, often with independent goals. Now, the difference, and something as a take-home message really I wanted to highlight, was that the MDT has to have this interdisciplinary approach to be effective. So this denotes that all those various disciplines are coordinated and working towards a common and coherent approach with total respect and understanding for each other's roles. So this may include a variety of professionals, and we'll have a look at really the most common when it comes to postural care individuals who might be involved, who then collaborate through joint planning, joint decision making, and ultimately joint goal setting. So that's the difference there. Now, all evidence indicates that this collaboration leads to more holistic, person-centred care. Individuals and their caregivers report higher levels of satisfaction when those care plans consider their physical, psychological, and social needs in this integrated way. Interdisciplinary collaboration allows us to complete more thorough and holistic assessments, which means the prescriptions are more comprehensive and our care plans are well thought out. And each, as we've already said, each professional will bring their own expertise to that, resulting in this understanding of the individual's needs, including their postural requirements, of course, but also those functional abilities, their well-being, their interaction, and all their preferred goals as well. Now, that information is going to be vital for the provision of the most appropriate postural care intervention and ultimately their care plan, and how seating solutions then can be confidently and consistently implemented. Now, this care coordination will improve significantly when, of course, professionals work together as a team, and we can see more efficient and more effective care by streamlining that communication and making sure that decision-making processes are done collaboratively as well. Different team members from different specialties can share knowledge and skills, ensure that the true best possible intervention is decided upon. This will then hopefully reduce the risk of miscommunication, duplication of services, delays in care delivery, and particularly for those individuals with the most complex of health needs who may require input from multiple specialties. So thinking about, where possible, joint visits, and as we said, streamlining that, not duplicating, maximising the time and the resources we have. And really not missing gaps as well, when we can become hyper-focused on one particular objective within our specialty. We might be losing lots of opportunity to use other specialties and use that to complement the therapies or the interventions that we are doing as well. So by integrating those different expertise, the individuals will really receive the care that addresses their medical, their physical, their psychological and social needs more comprehensively. So that true holistic approach that we're always striving towards, and hopefully prevent all those significant secondary complications that we've mentioned. But there is also a cost effectiveness element as well. So studies have shown that interdisciplinary working can save money, which I know we're always here for the individual, but we've always got that pressure as well over our shoulder that is only a certain amount of money, the budget constraints and certain resources. So we've got to play our role in making sure that we use that appropriately as well. Now, that initial investment in time and coordination with our team can mean that the overall costs of care are reduced due to fewer complications, better care coordination, and hopefully reduced hospital admissions and re-referrals, and then less intensive interventions as well, which are of course less costly. Now, there are particular challenges that you may have come across throughout your work and practice when we talk about MDT teams and that interdisciplinary approach. Research has shown that there are particular professional boundaries that can be a common challenge, leading to things like role confusion or a reluctance to collaborate fully. Now, I know we've only got a short period of time together during these webinars. So if this is something you wanted to read more around, then again, reach out. You'll have the references there anyway, but reach out if because there are some handy workbooks and team building exercises if this is a particular challenge that you're finding within postural care management and trying to work effectively with the MDT. But things that can help are things like clear role definitions. So right from the outset, investing in that joint meeting where you are highlighting what your objectives are and what your role is within that care plan. One, so you're not duplicating something that somebody else is already focusing on, but then also how to complement each other. Because if, for example, as a physio, I know that I need to understand how postural stability can help with their function, then I know that I can maybe streamline that with the work of the OT, who is going to be doing an activity analysis to see how we can best encourage that and work together. And instead of having two very separate appointments and having extra time needed with individual that's not needed, because we can do that jointly. And when we talk about resources as well and freeing up time. So from the very beginning, clear role definitions, what your objectives are and how we can then do that together. Joint training as well. So these a good foundation on joint training. So you have this shared objective when it comes to development. And again, that's something that Les, at the end, Les will highlight some of the ways in which CareFlex can help with that. Just to really have that team building and a shared perspective around postural care and a shared understanding. And all of this can really help to improve the working dynamics of the MDT. So let's spend some time then looking at some of the key professionals and the key specialties who may be involved when we talk about postural care. And of course, depending on the individual, the team, the wider MDT could go well beyond these individuals. We could be thinking that we need signposting to the continence team, to behaviour management. We may need support from the GP in terms of their health management or investigations, because we might be concerned about certain elements of their body structure that need further investigation, things like contractures. Do we need rehabilitation medicine to have a look at Botox management or spasticity management? Are we concerned about their home environment and maybe how they are being supported within that environment? Are there safeguarding concerns? Do we need to bring in social work? So of course, the wider team could go well beyond this, but I just wanted to highlight some of the key players who generally get involved when it comes to postural care. And as an idea, if these are people that are not known in your area, it might be a good scoping exercise to go out there and find out who these links are, so you can then rely on their expertise where's needed. So we're not having that narrow focus, we're expanding that holistic approach, because that's how we're going to get the most out of postural care. So occupational therapy then, the focus for the OT profession as a whole is to really support and enable people to do the things that they want to do in life with this strong focus on participation. OTs will bring this unique expertise to postural care by viewing function and participation holistically, utilising their skills of activity analysis, along with their experience of biomechanics around posture, to find the right solutions to overall enhance health and well-being, with that occupation in mind, hobbies, education, interaction with the environment and with loved ones and friends and family. Physiotherapy. When we think about physiotherapists, especially within postural care, assess the ability to assess the body structure and contribute valuable information about postural needs. We can provide strategies to maintain and hopefully improve, in some cases, the physical abilities by promoting active engagement. We can also collaborate with other team members as part of that monitoring and review process as well, to understand postural needs and how it changes over time. Rehabilitation engineering is the use of engineering principles to develop technological solutions and devices that can assist individuals who present with disabilities or with postural challenges, but also aid in the recovery as well of any physical and cognitive functions that may have been lost due to disease or injury or illness. They tend to, so the rehabilitation engineering team will design and build devices and systems that can meet a wide range of needs and really work with OTs, with physios, especially if maybe we are unable to intrinsically solve problems, where we need to look at extrinsic factors and bring in tools and devices to help people with day-to-day activities. And this leads into orthotics as well, who can help provide services around insoles, braces, splints, calipers, spinal braces and jackets, helmets, thinking about footwear, especially if we're trying to encourage transfers and mobility, if we are concerned about range of movement within the chair, if somebody has spasticity and they need the management through splints and so on. This is where we can really then lean on orthotics to maximise that postural care intervention. So we have our standard equipment, so we're thinking about wheelchairs and specialist seating and nighttime position, but then those little additions that really help the individual with their body structure and really looking down at the root cause of some of their physical presentations to help them recover or to really just manage lifelong conditions. We may need to rely on speech and language therapy as well, especially with individuals who may present with complex presentations, especially in sitting, because the speech and language therapists will provide us with that invaluable information on communication, on swallowing abilities, which will certainly influence our seating solution. It'll influence the functions that we're able to use safely and appropriately and help with positioning. So, for example, if somebody has been assessed by speech and language therapy to have swallow dysfunction, they have dysphagia, this could really have a significant impact on our use of things like tilt in space. Can they tolerate any tilt in space, or is it contraindicated? After eating and drinking, do they need to remain upright for half an hour and then they can tolerate 5-10 degrees of tilt in space? And these are things that we need to work closely with speech and language therapy to make sure that we highlight that in the care plan. And this really comes down to health and safety and making sure that we aren't increasing risk of things like choking incidents, aspirations, repeated infections and hospital admissions. So this is something we really need to highlight very early on about that collaboration with speech and language therapy. The role of nurses in postural care, again, depending on the client group and the individual you're working with, but they can play a critical role in monitoring the overall health and well-being. So they can be that point of contact, especially those of you who maybe work within learning disabilities. Sometimes they can take on that care coordination role. They may have more contact sometimes with family, with the individual, getting that feedback. So it's a really strong link if there are any concerns to highlight where reviews or monitoring needs to take place. They can communicate some of those changes back to us within the team. And as I said, be that link between the individual and their caregivers. They can also play a significant role, especially when we talk about tissue viability nursing, and contribute to that pressure injury prevention, and thinking about the care plan and some of the things we need to highlight in terms of pressure care. Maybe they've done their baseline assessments, they've done their Waterloo scores, and then they're working in collaboration with us to let us know actually what the risk is, because that might change our priorities around our seating objectives. Had we not had that highlighted, had we not had that link with nursing to understand what the risk is, we might have prioritised, for example, remaining upright for function and activity as a key factor, where actually that tilt and space, if it's appropriate, is more of a priority because we need to manage that immediate risk to their skin integrity. Now, all of this really comes down to that initial team working and having a look at how we fully and comprehensively assess the needs. So it's about being proactive, identifying risk, and working together to, I guess, gather the information that we need to help guide our management plan. That assessment of posture throughout the day and night, because it's a full 24-hour approach, needs to be examined within a multidisciplinary framework. And this is the only way that we can ensure the appropriate provision of postural care interventions that support the individual and matches the individual, the caregivers, and the clinical objectives all together. And of course, each discipline, each professional is going to consider that assessment from a slightly different perspective. But that's the benefit of it. That's a positive thing because it helps us have that multifaceted approach. One thing I would like to highlight here, because obviously we're focusing on the professionals in terms of the MDT, but I guess the purpose of this webinar as well is to highlight how CareFlex can support that, having our own seating assessors to be able to give you the expertise in the seating solutions themselves. They're the chair experts on the features and the accessories, and they're able to collaborate with you as the professional, as part of the MDT, to further develop that interdisciplinary working to find the most suitable seating solution. And again, Les can chat more about that at the end. And another key part of that assessment process, of course, because everything we do is person-centred, is going to be the individual. They still form part of that MDT, really, because they're a critical part of that collaboration. The success of specialist seating and any postural intervention is going to come down to the individual being compliant and consistent with whatever care plan we put in place. So we need that feedback to make sure that everyone has informed decisions, but also that individuals and the support network, especially if we're relying quite heavily on them, that they are not only competent, but they're confident in following that care plan, so that we know that when we leave that environment, because we can't be there 24/7, that we are confident that they will continue to implement the care plan and implement our interventions consistently to make sure that we achieve our clinical objectives. And again, just to highlight, because the whole purpose of these events is to educate and raise awareness, and one way that we do that is by making sure that we support you through that process for the lifetime of that chair, and at any point during that process, if you need extra support, if you need any guidance on where to find out more information, if you want to do some further learning, then a key part of that is just reaching out to us. Our website has a whole host of resources and information on there to help guide the assessment process and anything around postural care and how specialist seating fits into that. We've of course got our live monthly webinars, clinical justification documents, encyclopedia of specialist seating, pocketbook, case study. So just reach out to us. If you feel that there's a gap in the knowledge, then please reach out. If there's a joint training need, especially if you're working within the MDT and actually thinking we can improve our interdisciplinary approach here, especially from the point of postural care, then reach out and we can do those joint training sessions with you to really get you coming from the same understanding and clearly defining your roles maybe within postural care. So this interdisciplinary approach to multidisciplinary teams is what enables individuals that we work with to receive holistic, comprehensive, individualized interventions. So really, I want you to understand that MDT working is great, but we have to have that interdisciplinary approach to MDT teams. By addressing all aspects of an individual's health and well-being, we can work together to promote that compliance, because that's what's key to getting successful, effective care plans, that they are compliant with the intervention that we put in place. And then that's how we maximise quality of life. By having an interdisciplinary approach, it allows us to structure structure the process really from assessment through prescription and review. It allows those points of contact, it allows regular communication and updates between members, because that's a really important part of postural care. Not everyone is static, people don't stay the same. There are always slight variations and changes in daily life, whether somebody it has rehab potential, for example, or even if we know a particular diagnosis that sadly deteriorates, or somebody becomes unwell, those postural needs are always going to be changing and fluctuating. So if we have that team process where we have structured communication opportunities and review meetings, it allows for that feedback to make sure that we can adjust and adapt. That collaboration not only leads to better outcomes, of course, for the individual, but it also fosters this supportive environment as well for us as professionals, and we feel like we are contributing to that team environment. One thing I would say with regards to effective communication, and we touched on it about clearly defining our roles. It's always helpful, I think, in that investment or in that initial meeting, if you know you're going to be taking on a case, you know you're going to be working with an individual where it's clear, or the risk has been identified that there is a risk to their postural health. Actually define those roles, get that initial meeting and understand what everyone's objectives are. That means that you can streamline assessments. Can you do it all in one joint assessment? How many points of contact do we need to get that information gathering? And then once that we've had all that information from these subjective and objective assessments, we can then come back and debrief and understand what that problem list is. By highlighting the problem list from different disciplines and different objectives, we can then see if there's any overlap. For example, if somebody has been highlighted speech and language therapy, have understood that maybe there's a communication need here, actually a big part of daily life for them, and a big challenge is for them that's at the moment causing behavioural changes, it's causing problems within the care environment. It means they're becoming isolated. It's because they're lacking the interventions and the support that they need to communicate effectively. It might be that actually we've highlighted that they need a PEC system, for example, or eye gaze communication, and they've highlighted that as a really strong priority. Trying to then link that up to maybe the physio outcomes, where we're actually, okay, yeah, we agree we need to get them sitting upright, we need to get them interacting with the environment. How do we then bring that priority into our clinical objectives? Do we need to then work with the chair manufacturer, with CareFlex and the seating assessors to see how we can integrate things, how we can make sure that we have services to enable PEC systems and so on. So again, it's just coming and seeing whether we can complement each other rather than replicate. And if we have strong priorities in terms of their holistic needs, we can then grade it and decide, because there's an element of compromise as well when it comes to postural care. I might be thinking from a physio point of view, I really want to use this chair as an orthotic device. I think they really need this regular change of position throughout the day. It would be helpful if they had leg rest elevation. It'd be helpful if they had tilt in space, and really utilise it to use the effects of gravity to have different weight distribution throughout the chair, throughout the day, where actually we've had nursing involved, and they've highlighted there's a strong history here of pressure injuries. That doesn't really align to me using tilt in space, for example, if we don't manage that pelvic stability, first of all. So we need to make sure if tilt in space is going to be used, because there's a strong history of pressure injuries, they need to make sure that tilt in space is used appropriately and safely as part of that care plan. So we're reducing that shear and friction forces because of the history that's there. So again, there's this element of compromise between how much tilt can I use before we lose that pelvic stability, how much tilt throughout the day can I use so that they don't become fatigued. So it's just really highlighting that we need to complement one another, and we can achieve our holistic objectives by just communicating. And I think a big part of that is just showing gratitude and understanding, as saying simply thank you for helping with that, goes a long way. we'll be back on screen now. So that is kind of a lot of information to take on in terms of the interdisciplinary approach, but I just really wanted to highlight that we all know about MDT working, and that's fantastic that we've had that MDT if you're able to access those resources. But it's what do we do with that matters. We still have to have that interdisciplinary approach within the MDT to see the most effect from postural care. No postural care plan or provision should come from one person, because we need to utilise the skills and expertise of many different disciplines to really understand how we can maximise that. And hopefully CareFlex can play a role in supporting that.
So as a seating assessor, there's no such thing as too much information for me. There's the obvious factors that we need to consider: hip width, how somebody transfers in and out of the chair, prognosis, do they lean, is it sitting balance? Those are the obvious things, but the environmental factors can help as well. So all your kind of multidisciplinary, interdisciplinary meetings, if you like, I need to identify the key objectives and outcomes and goals from that, and try to match those postural challenges with features from the chairs. I'm the expert on the chair, and hopefully we can match and accommodate the postural challenges of your client.
Yeah, they're two very separate things, aren't they? We have the MDT working together collaboratively to come up with that problem list before coming to the seating assessment. We can't change the world in that one seating assessment if we don't have all that information beforehand. So it's coming armed with the holistic problem list from all those different specialties with the priorities, so then we can come up with the solutions to try and meet as much of those objectives as possible.
Yeah, and then from that list of objectives, I'm going to identify certain features and accessories on a product that may be helpful. We try to provide the simplest possible solution, but we need to future-proof things as well. So again, those outcomes and goals and objectives are really key for me to be able to identify the most appropriate seating solution for your client.
Yeah, and one thing that as well to be mindful of when we think about the MDT, and I guess when it comes to postural care, we may be working with individuals with high complexity needs, which then may come with cognitive issues and challenges. So that MDT is going to be really key around things like capacity to consent as well. So having all that done before coming to the seating assessment is going to be really key to maximising that time. So do you need to sit down? Are there concerns around their capacity to understand powered functions? Do they understand how detrimental back angle recline could be? Are they able to consent to positioning aids, or is there some concerns around deprivation of liberty? Do we need to then, as an MDT, decide on that and come up with those decisions, whether that's in best interest or guardianship, depending on where you are in the world, really, would depend on what those legislation is. But then coming armed and already having done that work to maximise the seating assessment in that time that we have together.
Yeah. And I mean, the focus of the session has been around assessment, if you like, almost pre-chair provision.
Mm-hmm.
But what's really, really important for me as a seating assessor is the chair setup, to make sure that the needs of the client are fully met, the chair is adjusted appropriately for your client. And rolling on from that, the review process as well, so that we can monitor the effectiveness of the intervention. So those are key elements. We really do look at the provision of the product as a service and not just here's the chair, off you go. We try to support the chair
for the lifetime of
the product. Yeah.
So and I guess a key part of that is having a point of contact. That's one tip I would say, that of course you're going to hopefully have your team, you're going to have your MDT that's working collaboratively, but then having maybe a champion or somebody who takes the lead on particular elements, so that as part of that monitoring review there is someone who can reach out and there is someone who can guide that, and then call everyone in again if that's needed. But that's always a handy tip, especially in the care plan, that there is that point of contact.
Consistency.
Yeah. But that's a lot of information to get through in kind of 45 minutes. Are there any questions, Kim?
We do have a question more regarding the actual chairs. Do we have any advice for children with extensor spasm? They work in a community in paediatrics.
Okay. I mean, again, depending on the severity, I guess the one thing is maybe trying to find out what the particular trigger is for that extensor thrust for them. Is it when they become excited? Is it pain? And then the big part of that, I guess, the point that we see the most is the transfer. So having a look at the transfers into and out of. But with any kind of seating solution, the key is getting that pelvic stability. When we talk about an extensor thrust, when we talk about tonal changes and reflexes, research has shown that if we can kind of break that patterning and get into a good pelvic stability with the hip flexed, we can try and dampen down some of those abnormal movement patterns. So transfers, trying to streamline that, trying to utilize tilt in space on the chair to get gravity. If they're hoisted, for example, it does make it somewhat easier because we can tilt the chair, we can use gravity to get the pelvis right into the back of the chair, and then depending on, I guess, the priorities and how we've gone through their assessment, obviously least restrictive first, to try and get that pelvic stability, thinking about tilt in space, then building up then to contoured cushions, ramped bases, and then on to positioning aids as that last resort. But certainly trying to keep the hips flexed within the chair.
So that would indicate to me that I'm going to have to look at a chair with back angle recline first and foremost, really, and then adjust the chair to get that pelvic stability.
Hope that answers the question. If somebody's got anything client specific, then yeah, just send us an email. It can be a bit more specific, a bit more tailored then. But certainly what we found with seating is if we can keep those hips flexed, and we can utilize gravity and slight tilt to get the pelvis into the back of the chair to try and dampen down some of those really strong movement patterns. But again, it's on the individual, depending how severe and how strong that thrust is.
Can you recommend some resources for a physio working in learning disability for postural care?
Yeah, of course. If Kim, if you can take details, then there's a whole host of stuff that's helped me personally. I specialised in learning disabilities as soon as I graduated, is what I've done over the last 15 years. So I can certainly try and help kind of with a reading list of stuff that's helped me personally. But yeah, if you just take the details, Kim, then I can share that. Those of you who are interested in posture or want to know more, Pauline Pope has some great resources as well, and a good book on neurological rehabilitation when it comes to posture, and that's helped me. I don't get any gratuities or anything for that. I'm not related, but it's something that's helped me. But yeah, if you take the details, Kim, I'm more than happy to share those.
Yeah, there's quite a few people asking for a signpost to other resources, so I think we'll do a bit of a list when I send out the.
Send it out with a presentation.
Can you increase?
Yeah, I mean it's a bit. Sorry, go on.
Sorry, it was just another question on increasing the height and angle of armrests, especially those who have no function of the upper limbs and falling back off the armrest.
Okay, so to support somebody.
Yeah.
Okay.
So yes is the answer. As standard chairs come with seat width, seat depth, arm height adjustment.
That's independent as well, from left to right, from front to back. So if you need to be really specific with support, if you needed to angle or height or have difference from left to right, then again, totally independent of each other. One thing we have done, it depending on how severe it is using the tray. If it's just for support, if actually they've sadly come to a point where they've developed these contractures, these secondary complications have happened, and we're just looking for comfort and stability, padded trays, and we've put B cushions on so they can really just encompass for comfort reasons, because what we found by giving that kind of anterior support to try and dampen down those reflexes, to give them a surface to be able to relax into and settle into over time, because we might have got to the point where sadly they've become non-functioning, but actually we still need to think about the stability and the comfort, and reducing the pain that's associated with, if that's spasticity management, for example.
Yeah, the other thing we could do, I mean, that's a standard feature in all our chairs, that arm height adjustment, but we have a service called Tailored Solutions, which is a bespoke manufacturing process. So, for example, we could be putting a gutter arm on here. We could be increasing the amount of foam or padding on here to further increase the arm height. There's a whole range of things we could do. And again, as part of the service, that's the seating assessors function, if you like, is to suggest potential solutions to that postural challenge.
Yeah.
Thank you both. That's all the questions for now, and just I will add a list of resources to the emails that go out with the CPD and a recording of today.
Brilliant, thank you. Yeah, I mean, postural management, once you start diving in, is a complex, challenging field, and the more you learn, the more equipped you'll be in identifying risk, and just really think about that 24-hour approach. Obviously, we focus in on specialist seating because it's the nature of us as a manufacturer, but it's how that chair plays a role within that full 24 picture. So yeah, we can get a list together and send that out.
Okay, well, thank you very much for attending this afternoon's webinar. We're at the OT show later on in November. If you'd like to come and see us, please come and have a chat. Thank you, and we'll finish for the day. Thank you very much.
Thank you very much. Thank you for joining us.
Cheers then. Bye-bye.
Bye.